Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're diving into four big stories: a potential dismantling of one of the country's most important health panels, a serious public health scare in New York City, and yes, a rare example of good news on cancer screening. And because it's apparently 1925 now and not 2025, the federal government just slashed hundreds of millions of dollars in funding for mRNA vaccine development. Let's get into it. First up, prevention. You know, that quiet corner of healthcare that saves lives and billions of dollars and yet somehow always ends up on the chopping block. Senators Angus and Elizabeth Warren just introduced a resolution supporting the U.S. Preventive Services Task Force, or USPSTF for those of us who like acronyms. Why did they do this? Because Health and Human Services Secretary Robert F. Kennedy Jr. is reportedly considering firing all 16 of its current members. Let me say that again. This is not about revising policy, not about expanding the task force's capacity. Firing every single member. This group of independent medical experts has been guiding preventive care in the U.S. for over 40 years. Their recommendations determine what services your insurance carrier must cover with no out-of-pocket costs, from mammograms to colon cancer screenings to depression checks. Senator King put it plainly: prevention is at the heart of how we need to approach the cost of healthcare in this country. The resolution doesn't carry legal weight, but it sends a message loud and clear that science-based health policy shouldn't be politicized or gutted. Because if you dismantle the task force, you don't just kill the messenger, you lose the message. And that message often is what catches diseases early and saves lives. Here's a perfect example of why the task force matters: colorectal cancer screening. Not exactly cocktail party conversation, I know, but stay with me. In 2021, the USPSTF lowered the recommended age for colorectal cancer screening from 50 to 45 for adults at average risk. That means insurers now have to cover these screenings at no cost for this younger age group. And guess what? It's working. New data recently released shows a rise in early-stage colorectal cancer diagnoses in adults ages 45 to 49, and that's actually great news. We're catching cancer earlier when it's more treatable and survivable. That is what smart, science-based policy looks like in action. And it's exactly the kind of progress that's at risk if we let politicians hijack prevention. Let's be blunt. If RFK Jr. replaces the task force's experts with conspiracy-adjacent influencers or vitamin-hawking pseudo-doctors, we won't just lose trust, we will lose lives. Speaking of science losing the spotlight, RFK Jr. just canceled nearly $500 million in grant and contracts for mRNA vaccine development. This follows his earlier move to kill a $600 million contract with Moderna for a bird flu vaccine. That's over $1 billion in funding gone. And with it, 22 separate mRNA projects that scientists say were critical for future pandemic preparedness. To be clear, mRNA vaccines are not fringe science. They are a Nobel Prize-winning platform that saved millions of lives during COVID-19. They're fast to develop, easily adaptable, and critical to biodefense. But RFK Jr. isn't just cutting funding. He's also spreading misinformation, falsely claiming that mRNA vaccines don't work against respiratory illness and suggesting that technology is a failure. Experts are pushing back. One called this a, quote, bad day for science. Another called it a, quote, national security vulnerability. A third warned that the U.S. is now weakening its frontline defense against fast-moving pathogens. So instead of investing in our future, we are doubling down on a 100-year-old wholesale vaccines that we stopped using in the U.S. decades ago because they cause fevers and seizures. It's hard to overstate the damage this kind of policy shift can cause, not just in public health, but in global trust, research partnerships, and our ability to fight the next outbreak. Now let's talk about what's happening in New York City. Up in Harlem, public officials are responding to an outbreak of Legionnaires disease. As of this recording, 2 people have died and 58 have been sickened. The New York City Department of Health has been tracking the outbreak since late July and has already disinfected 11 cooling towers that tested positive for Legionnaires disease. This isn't a contagious disease. You don't get it from people. You get it from breathing in contaminated water vapor from things like air conditioning systems, whirlpool spas, or even humidifiers. And while it's treatable with antibiotics, it's also dangerous, especially for adults over 50, smokers, and people with chronic lung conditions. If you live in an area of contamination or nearby and have flu-like symptoms, fever, cough, shortness of breath, don't wait. Call a doctor. Early diagnosis makes all the difference. This outbreak is a stark reminder that public health infrastructure doesn't just sit in labs or policy papers, it's in the air we breathe, literally in this case. So what ties all these stories together? Simple. The importance of public health systems grounded in science. The U.S. Preventive Services Task Force saves lives by keeping health recommendations evidence-based and up-to-date. The Legionnaires outbreak reminds us why we need vigilant, coordinated health departments. And the colorectal's cancer screening story proves that when we follow the data, we get results. It's no coincidence that all 4 of today's stories orbit a single theme. Public health works when it's grounded in science and falls apart when it's hijacked by ideology. So if you're feeling a bit overwhelmed by all this news, take heart. Prevention is powerful, and it's worth defending. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.